I'm Michaela Roman, and this is the Community Intervention Analysis of the Cabarrus County Social Determinants of Health Accelerator Plan. Cabarrus County is located above Charlotte, is about 362 square miles, and here's the population. It is predominantly white, but with 20% Black and 8% Hispanic population. In the area, there is income inequality, with whites making the largest median income, followed by Hispanics, and then African Americans. In 2021, Cabarrus Health Alliance, the local health department, created the 2021 Health Equity Report. It defined health equity as fair and just opportunity for all people to have accessible health care and achieve overall positive health outcomes. However, it found that in Cabarrus County, African Americans are 1.08 times more likely to die from cancer, 2.21 times more likely to die from diabetes, and 1.13 times more likely to die from heart disease compared to white residents in the same area. The CDC has provided funding to the sites you can see on the map behind the slide to have the Social Determinants of Health Accelerator Plan. This funding was to focus on reducing equity gaps related to social determinants of health using the built environment and community clinical linkages. Cabarrus County decided to focus on housing access for residents and healthcare access for residents. Specifically, they wanted to focus on African American and Hispanic populations in the Cabarrus County area. The Social Determinants of Health Accelerator Plan does have a social justice and human rights emphasis. If you compare the definition of, or this article from the United Nations Declaration of Human Rights from 1984, Article 25, it emphasizes adequate living and health, which include food, clothing, housing, medical care, and social services. The NASW Code of Ethics looks at social justice as one of its core ethical values. And within the Code of Ethics, there's a focus on vulnerable and oppressed individuals and social workers' efforts to address poverty, unemployment, discrimination, and other forms of social injustice. With this plan's emphasis on increasing housing access and healthcare access for these minority populations, there is a strong social justice and human rights focus for this plan. However, one caveat I would give to that is that the program or the plan so far has focused on a literacy plan to combat these issues, which may not be as critical or power focused as might be necessary to create lasting change. In terms of power, the initial power behind this initiative comes from the CDC because it is the funding source. It's also seen as the expert in health in the United States. So it has both an expert focus and an ideological power source, as the stipulations of the grant determine how the money is used and how our plan is initiated. Cabarrus Health Alliance has the funds from the grant and are leading the planning steps for this initiative. And finally, the community organizations that are a part of this collaborative have both expert and collaborative power. Participation and engagement in this initiative thus far really focuses on local community organizations who are attending meetings and beginning to plan on how to deal with the health and financial inequalities. Here you can see a listing of the organizations that are currently participating in the plan. Participation by community members right now is not an active role. While the community was addressed to come up with some of these concerns through the health equity report and a needs assessment done by CHA, that would be kind of the consultation level of of Arnstein's ladder of participation. However, if this initiative decides to go forward with a literacy approach only and does not focus on any policy changes or advocacy, this would be at the manipulation or therapy level of Arnstein's ladder, trying to change the way that populations think about their money and think about healthcare access rather than making those things actually easier and reducing barriers. The practice model being used by the Social Determinants of Health Accelerator plan is primarily a structural approach, looking at the data about these different sectors and trying to make changes within the existing structures. From the Rothman perspective, it has a policy and planning approach with a goal of community development. So increasing the ability of community members to participate in their housing process and healthcare process, but it's policy and planning primarily because it's focusing a lot on data and expert opinion. Within the Wheel and Gamble 8 model framework, which kind of breaks down different practice models with more distinction, I would say that the best fit would be a coalition model, given that there's so much community involvement from local organizations and nonprofits. So for selecting and adapting interventions, the material said that the criteria for good programs include responsiveness, flexibility, egalitarianism, collaboration, good management, competence, awareness of context, and commitment to a clear long-term mission. So given that this initiative is in its planning phases, I feel like it does have some of these aspects, such as responsiveness to the data, flexibility in how we're going to roll it out, egalitarianism amongst those who are participating, and also collaboration from all these different organizations. So far, there's been great management by Cabarrus Health Alliance, but going forward, we'll have to be aware of competence, so training staff to do literacy in a way that's culturally competent, also being aware of the context, and creating this plan in such a way that it will be long-lasting. A pilot approach to the financial and health literacy classes. So here you can see that for African American and Hispanic communities, they have some similarities in the approach that could be used in these pilot programs, but there's also some key differences, and some of this comes from the material. Basically, for both of these communities, establishing trust will be important. Meeting in a space that is comfortable so individuals will come. But for Hispanic populations, obviously the materials are going to need to be adapted. For African American populations, there needs to be a real recognition of historical discrimination in both of these areas. So technology being used by this initiative at the moment is mostly email, audiovisual presentations as we are just getting started. Going forward, they would like to create a data dashboard that utilizes data from all of the participating organizations to see where things are at for their populations. Also using social media to advertise or creating a social marketing campaign to encourage participation in these literacy approaches. So this is a brief logic model that could be used to evaluate this plan to see if it meets its long-term goals of improved housing and healthcare access, utilizing the literacy skills, decreasing housing cost burden, and underserved community members when in terms of healthcare. So dissemination of evaluation results is important so that we can celebrate positive outcomes, learn from growth opportunities, and encourage funding and participation going forward. Methods of dissemination could include a presentation for community members and stakeholders, the publication of the report online, using media sources like radio or regular news, and also having the report available in paper copies at organizations who have participated in the initiative for individuals to view and review at their convenience. Here are the references used for this analysis, and if you have any more questions about this plan or its future, feel free to reach out.